my name is Anna. I'm going to be doing my injection side. So first I'm going to be starting off with the deltoid, which is intramuscular. I'm going to be doing 3 fingers past the acromion process and not below midline. I'm going to be making a triangle shape, and for my injection I'm going to be going in the middle of the triangle at a 90-degree angle for intramuscular and making sure my patient's arm is relaxed. Then I'm going to be doing the dorsolateral aspect, which is the upper arm, and I'm going to be doing below midline, 3 fingers below midline, and then 3 fingers above the acromion process. And it's going to be a rectangle shape, and it's going to be towards the back of the patient's arm. And since it's subcutaneous, you do it at a 90 or a 45-degree angle, depending on the depth of the skin and the length of the needle. And then I'm going to be doing abdomen, which is for subcutaneous. And for this, I'm going to be doing a 2-inch margin around the umbilicus and not going below the pubis or above the costal margin, and then not going past on the anterior superior iliac spine. And it's going to be a U shape, and I can do a 3-finger interval for multiple injection sites, and then I can do heparin or insulin, and I can do this at a 45 or a 90 or a 45-degree angle, depending on the depth of the tissue and the length of the needle. Now I'm going to be doing the ventrogluteal, which is intramuscular. I'm going to have the patient lay on their side and be standing on the side facing the patient. I'm going to move the patient's leg to feel for the greater trochanter, and I do feel it. So I'm going to be putting my palm on the greater trochanter, on the femur, and I'm going to be putting my thumb, it's going to be facing towards the groin or the umbilical area. My index finger is going to be pointing towards the anterior superior iliac spine. My second finger is going to be moving the skin towards the iliac crest. And then since it's intramuscular, I'm going to do my alcohol wipe, place it there so I can readjust. And then I'm going to be coming at a 90-degree angle and making sure on my injection, making sure I don't feel any bony area. Now I'm going to be doing the vastus lateralis. I'm going to have the patient sit up and their leg like this, and I'm going to be this can be subcutaneous or intramuscular. I'm going to feel for the greater trochanter. I'm putting 4 fingers down, and then on the above the knee, putting 4 fingers down, and it's going to be a rectangle shape, and making sure I'm not going past midline on the top or past midline on the side. And then for the rectangle, it's going to be on the middle 1/3 area. And for subcutaneous, it can be at a 90-degree angle. And for intramuscular, or subcutaneous can be a 90-degree or a 45-degree angle. Intramuscular can be at a 90-degree angle. And for the subcutaneous, depending on the length of the needle or the depth of the skin for which angle.